Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for Phelon or Whitlow. What is Phelon or Whitlow? Phelon or Whitlow or Herpetic Whitlow or Whitlow on finger, Whitlow finger. There are so many names for the same disease. Occurs when Herpes Simplex Virus (HSV) infects skin around finger, particularly fingertip, and causes infection. Less commonly, it can also infect toes. Bacterial infection can also cause Phelon, though rarely. Now, the pictures of Phelons, at least 3 different pictures I have shown here. The first one, the second one, and the third one. This is a starting phase. This is some mid-time phase. This is almost advanced stage. This is Phelon. What are the sign symptoms of Phelon? Pain, fluid pus-filled blisters which later burst and scab over. Swelling, burning or tingling sensation, that is in the finger. Color change, fever, swelling of lymph node nearby, red streaks around affected nail or toe. How long does Phelon last? The incubation period of the virus, that is HSV virus, 2 to 20 days after exposure to virus. Once the infection sets in, vesicle starts appearing within 5 to 6 days. Generally, symptoms resolve within 2 to 4 weeks without treatment. Without treatment, it generally resolves. But there is suffering, severe suffering. So remedies are required to alleviate the pains and sufferings. Can Phelon recur? Yes, it may, very often in the same place, and the victim usually feels a particular pattern of symptoms, say itching, tingling, burning, before blister appears. However, the following recurrences which are coming after, following recurrences are weaker in manifestation compared to the first one. That is, first attack is most severe. Thereafter, infections are lesser in intensity. Following factors increase the chance of recurrence: too much sun exposure, excessive stress, physical, mental, emotional trauma, weakened immune system, hormonal imbalance. What can one do to ease the suffering of Phelon? Phelon is a disease which gives a lot of suffering to the patient. So, one must try to ease following some general means. That general means that is applicable in each case are being discussed here. Cover the affected area with light bandage, etc. Don't touch the affected area. If there is severe pain, sling the hand with a triangular bandage. Note, the particular hand has been slinged on a triangular bandage. This will reduce the pain in the hand. Never try to drain any vesicle or pustules yourself. This is very dangerous thing. It is very dangerous. Very often one tries to do it, but one should not do it. Wash hands before touching the affected area and also after. That is, after touching, before touching. One must wash his hand or hand. Keep yourself separated from others. This means yourself means if you are already infected, to stop spreading infection. Though virus infection is immune to common antiseptic solution like Savlon, Dettol, etc., yet to stop secondary infection by bacteria, etc., this solution may be used once or twice a day with a thin gauze. That is, placing with the thin gauze just moistened with this solution, Savlon, Dettol, placing over the affected area, then lightly bandaging. Avoid using contact lenses. If you use contact lens, there will be severe infection in the eye also, because viral infection is in eye is very common. Get remedies to ease pain and other symptoms. That is, if you want to ease your suffering, you have also to get proper remedies. Total suffering period. Salicylic for felon. Whenever there is a tendency to occur felon, give 3x 1 dose, that is 3 tabs every 2 hours. Foment the affected area with hot water 4 to 5 times a day. This is a common general measure. Common general measure, you can do it almost in every cases, particularly when hot water is ameliorating. Belladonna for felon. Unbearable throbbing pain with fever, face red hot, give 3, that is belladonna 3 hourly. Hypersulf for felon. Acts better if used before suppuration. Patients hypersensitive to all external impatience. External is light, sound, noise, everything. Violent throbbing, burning, cutting pain, slight touch unbearable. Give Hypersulf 6 3 hourly. Rustux for felon. Slow local development, dark red, erysipelatous with little blisters or edema. Pain running up the armpit. Use 6 3 hourly. Sulfur for felon. When Apis has given result partly, it completes the cure. Use 34 hourly. And sulfur, common sulfur symptom, that is burning sensation, restlessness, this will be always there. Acid fluoric for felon. Acute throbbing pain, much under the nail, offensive discharge, worse from cold applications. Use 34 hourly. Arsenicum for felon. Forepart of finger swollen much, dark burning, better from warm fermentation. Use 34 hourly. Alumina for felon. Nails brittle or thick with lancinating pain and spots on nails, various possibly white spot, yellow spot on nail. Tendency to ulceration of finger tips, gnawing pains beneath nail. Use 33 hourly. Antimicrote for felon. Deficient nail growth, split nails, thick horny callosities over the skin. Use 6 2 hourly. Lidum pearl for felon. Troubles, consequence of injuries as by pulling off abruptly a hangnail. That is, this is related to some accidental situations. Accidental situation. You have suddenly pulled off a hangnail, and thereafter felon starts. In that case, this lidum will be most important. During sewing, for first stage only, use 6 2 hourly. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I would certainly respond.